The aesthetic sense is sometimes one of the most difficult things to understand. That's why a lot of these other trained physicians and other subspecialties that take on plastic surgery, what the missing component is, it's not just about squeezing some fillers or some stem cells into the face, it's understanding the aesthetic components. So my aesthetic components started early on when I took on to sculpting and drawing and all these things at a very early age. But then I refined these basic sense of skills in training. And more importantly than your aesthetic sense is also identifying how the tissue forms and how it heals over time in order to give someone that desired aesthetic result. And that is the key component. It's really a personal conversation you have with the patient, understanding what they want. I'll give you an example. A woman comes in and essentially she might have a certain type of breast tissue in which she is unhappy with. Maybe she had a couple children and wants it to be lifted, or she wants it to be lifted, but not only a lot of times when the breast tissue is falling to the side or falling in medially or inward, you have to lift it up and bring back that tissue to where it once was. I say plastic surgery is a lot like real estate. Location, location, location. The real estate used to be up here, and then over time these Cooper suspensory ligaments sag, and now your nipple areolar complex is falling to the wayside, and essentially you have to bring back this soft tissue layer up to that same location. So it's understanding what the patients want, their desired results. Sometimes I'll ask patients to bring in a picture of what they think the most aesthetic desired end result is, and I'll help them organize it and understand what we need to do in order to get to that path. Within society and with aesthetics, obviously this is all influenced through your external environment and society and what people perceive as being attractive. Back in the 1800s, again, if you look at even during the time of the Egyptian periods, in which essentially at that particular point in time, people thought that maybe a more well-developed, a rounder, well-contoured, more of a voluptuous woman was considered to be attractive. And at that time, for years, people thought, look at the paintings of Renoir, and his paintings of these nude or semi-nude women were almost of a full-figured woman. And then over a period of time, you have society change these perceptions, and now you have like these runway models, in which these designers put on articles of clothing on them, and then they walk down this runway, and that's perceived as being attractive. And suddenly, as people look and say, wow, at one time, what's considered to be was healthy and attractive is no longer considered to be healthy and attractive. Over a period of time, society has changed what's considered to be attractive. But just because, society sees it as being attractive doesn't mean it's attractive to that one individual. Truly eyes is in the beauty of the beholder, and that is the key factor in identifying what's attractive. It's sort of like an architect and an engineer working together to build a building. You need the architect and you need the structural engineer, and the architect might say, well, I think this design is gorgeous, but it might not be structurally sound. And you need these two people to work together, just like the plastic surgeon and the patient. The patient might say, I want to have these lips which are super large because maybe their height, their weight, their body type, maybe the general aesthetics of their face and the dimensions of their face, their cephalometrics, so to speak, doesn't translate to fitting on their face, because the ratio, aesthetics is also based on ratios in regards to looking at components of their face. I'll give you an example. The most attractive looking faces are also the ones that are most symmetric. So if you take from the upper hairline to the brow, which is usually a third, from the brow to the base of the nose is measured to be a third of your face, and from the base of the nose to the chin is about a third of your face. And also you can do this in fifths, like for instance, the width of your eye should be basically about the width of your nose, or this area might be slightly a little bit smaller. And then also the ratio of your lips, your upper lip to your lower lip. So it's about balance, and you have to be honest and straightforward with patients. Obviously, the most important thing is safety. Safety comes by far the first thing out of everything, and then getting you excellent aesthetic results by understanding what the patients want. Even if there are new innovative ideas out there, it's fine to push the envelope, but you still need to identify and understand the limiting step. And there is no magic silver bullet out there. When patients come in, whether it be for reconstruction or for cosmetic surgery or aesthetic surgery, essentially you have to identify what they want and what their needs are, and what you can do to give them that outcome. And managing expectations. You have some patients who come in and, for instance, maybe they have a significant burn injury to their body and they want to make their skin normal again. There are only certain things we can do to make that happen. And then you have to apply your understanding of the aesthetic subunits in order to get those cosmetic results, meaning that, a breast is not just a lump of tissue that's on your chest wall. You have to pay attention to the aesthetic components of a breast. It has a superior upper pole fullness. You have this lateral sweep. You have this shape and a chest mound that is on your chest, but has the aesthetic natures and contours of a breast. So in understanding these basic concepts, that's how you help people reach their aesthetic goals. A lot of times, there's a lot of different types of fillers which are out there, and not all fillers are created equal. Some fillers are meant to be in the body in certain areas, and some fillers were not meant to be in the body in certain areas. And we had a few patients who have come to me and says, "Oh, look, I went to Salon, I went to some place and had some physician inject some fillers in my nose, and it was radius, and maybe they went too deep, or maybe they didn't put it in the right tissue plane, and they got maybe a poor aesthetic result." And certain things, even though they're innovative and new, doesn't mean necessarily that it's best for that one particular patient. And it depends on how you administer that particular type of product. Every year, and more so, there are conferences throughout the world and also the nation in which physicians, especially plastic and reconstructive surgeons, get together in order to present their cases or talk about the erroneous things that are out there that other people are trying to promote and market, and certain things which are truly set within, that fall within the standard of care, and which are giving you reproducible, excellent outcomes. So there are always people out there who are trying to say, well, this is the latest, greatest thing, but until that's been proven through a randomized prospective study or a double-blind study, that's yet to be shown that it can get you reproducible results. So it's so important that, yes, you have to follow technology, and there are these new innovative things that are out there, but unless it's been trialed by a standard organization, I wouldn't just go ahead and jump on the bandwagon, so to speak, to have certain things done until it's been truly processed in a way that's going to give you these excellent results that you search for.